Get started. Thank you, everyone.
All right, thank you. Hello, everybody. Good afternoon. My name is Leanne Burge. I'm the CEO of Community Health Plan of Washington and Community Health Network of Washington. And I'm very happy to be here this afternoon to have this virtual presentation of partnering in health equity. I think it'd be more fun if we were together in person, but we're doing the best we can given our circumstances. So thank you all for attending, and I do appreciate the time that everybody's giving to this opportunity. I just wanted to read some prepared remarks because I wanted to make sure I got it right in terms of expressing our reasons for this presentation and why it's so important to us to be part of the community that is working towards health equity. Many of the folks that are here today are already friends of ours. They're friends of CHPW and certainly of our members. You work with our case management staff or our regional managers. So we've worked together. We partnered on events and sponsorships and working with our members in the past. I really want to welcome you for taking the time out of your busy schedule to be present today. I'm happy to have you join us for a celebration of the power of community and acknowledge our shared work in advancing health equity. I want to begin with a land acknowledgement. We recognize that CHPW's headquarters office in Seattle is on the traditional lands of the Coast Salish people, specifically the Duwamish tribe. Seattle is covered by the Treaty of Point Elliott, which was signed under duress in 1855 before Washington was a state. As an organization and as individuals, we seek to approach each member, each staff associate, and each partner as someone deeply deserving of respect. We cannot presume to know someone else's experiences, and each person is richly deserving of us listening to them. As I look across the screen, I'm deeply humbled by the power of the communities and experiences that you all represent. And I hope that today is a step in deepening our listening to you and the people that we all serve. With proper and due respect, I'd like to share an old native fable. One evening, a Cherokee elder told his grandson about a battle that goes on inside people. He said, "The battle is between two wolves inside us all. One is evil. It is anger, envy, jealousy, sorrow, regret, greed, arrogance, self-pity, guilt, resentment, inferiority, lies, false pride, superiority, and ego. The other wolf is the creator. It is joy, peace, love, hope, serenity, humility, kindness, benevolence, empathy, generosity, truth, compassion, and faith." The grandson thought about it for a minute, and then he asked his grandfather, "Which wolf wins?" The elder Cherokee simply replied, "The one you feed." This is certainly true of us as individuals, and it's also true of us as a community and as a society, which is why it is such an honor to stop for a moment and give our attention to the collective good that's assembled here today, the collective power for positive change in providing improved health outcomes and well-being for thousands and thousands of people, for all communities. We are the power of community. As we see every day, the fight for health and social equity is ongoing. It's hard and it's necessary. Perhaps 2020, like few years in recent times, has shown that we must be active advocates and vocal, and we must stand together against the bad wolf, which has been well fed these days. I don't have to list for any of you the more recent assaults on Black, Indigenous, and people of color as a result of everything from the pandemic to federal immigration rules. In order to address systemic racial injustice in healthcare, we need to acknowledge all of the factors that prohibit equitable health for people of color. This includes addressing racism and other social determinants of health, environmental, housing, education, and other systemic factors associated with poverty that limit health and well-being. Most of all, the power of community means standing together so that the good wolf wins. As many of you know, CHPW was founded in 1992 as part of Migrant and Community Health Center's recognition that certain communities did not have equitable access to high-quality health coverage and services. The Community Health Center movement was part of the Civil Rights Movement, recognizing the need to address systemic healthcare inequities. That's the whole reason CHPW exists. Community Health Plan of Washington, Community Health Network of Washington. Nearly 30 years later, we remain committed to making our healthcare system more equitable for all people in Washington state. We serve approximately 250,000 people across the state for our Medicare and Medicaid lines of business as a health plan, and our community health centers serve over 1 million patients in the state of Washington. As a not-for-profit health plan, we've always been committed to reinvesting in the communities that we serve. And given the stark health disparities that COVID has shed light on, we have adjusted our community support program accordingly. The pandemic has disproportionately impacted people of color. You all know that. Black people have been hospitalized and have died from COVID at between 2 to 3 times the rate of white people. The statistics are stark for Latino communities. According to some sources, Latinos have been hospitalized or died at 3 times the rate of white people. There are many reasons for these disparities, but what is clear is that the underlying systemic inequities, the social determinants of health, are the underlying cause. So today we are happy to announce that there are 23 organizations who are each receiving $10,000 from CHPW to provide direct service specifically to communities of color and those disproportionately impacted by COVID-19. And now I'm very privileged to turn the microphone over to our first guest speaker, Olympia Edwards, founder and executive director of Project Girl in Edmonds, Washington. And just very briefly, Project Girl mentoring programs help young women of color in making positive life choices and to maximize their authentic potential through their 2 main programs, Emerge and Inspire. Project Girl provides life skills and critical thinking about issues facing young women of color. Thank you, Olympia, for joining us today.
Thank you for having me. So Project Girl Mentoring Program is an organization that I started out in Edmonds, and we service girls up from Shoreline all the way up to Stanwood, just about where we work with girls to help them develop their coping skills and their life skills, to help them, give them really tools and techniques that they can transfer from the setting that we're in into real life. And so sometimes that looks like them slowing down and actually thinking about things in a different way, or being open. And we do it in a group setting so that we can really help girls understand sisterhood and understand community and really be a part of supporting each other. The way that we plan on using the funds is that we're just going to grow our programs, continue to do the things that we are doing remarkably in our program. The past week, we're actually able to do a back to school bash, and we were able to provide girls with TI-83 calculators and headphones, especially for our population of girls who are at home and they're able to do homeschool so that they can have the tools and the techniques that they need to really make sure that this year that nothing would deter them from being able to hear their teachers and really be able to focus and concentrate in while they're in schools. Other ways that we plan on using the money is to team up with other organizations in the area and continue doing the mentorship and launch our tele-mentoring program, where we're able to talk to girls via phone or on the internet, and just kind of help them process a lot of things that are happening. Because as adults, as we're going through stuff and we're trying to understand it, they're on the other side and they're going through stuff and they're trying to understand it as well. So that's the way that we plan on using the funds, and we really do appreciate you guys supporting our program.
Leanne, you want to unmute?
Automatically muted me because I did not do that to myself. But I just wanted to say that that's great to hear. That's a wonderful use of the dollars, and we certainly know how much difficulty kids are having this year during the pandemic in getting the education, and there is such disparities in that regard as well between those who have more means than others, and it's such an important part of communities to make sure that people cannot lose ground on their education. So thank you for that. I just want to also introduce our next speaker, which is Katie Padilla, who is the Executive Director of the Nuestra Casa in the Lower Yakima Valley. And this organization was founded in 2003 and was quickly became a place where women can find resources, educational services, support, and empowerment. And to date, Nuestra Casa annually assists over 1,000 immigrant adults through classes, workshops, and referral services. So I turn it over to Katie.
Hi, everyone. Thank you, Leanne. So yes, through education, empowerment, and mutual support, Nuestra Casa enables immigrant women to create positive changes in themselves, their families, and their communities. Nuestra Casa is located in Sunnyside. We are part of the beautiful Yakima Valley. Unfortunately, our community has been one of the most disproportionately affected by COVID, but is now also being affected by the fires happening around the state. With that being said, we have been fortunate to continue providing services during this pandemic on a very different scope than we are used to, but still very much needed. We have not only strengthened our relationship with our students, but also with our community partners. This funding provided by Community Health Plan of Washington allows Nuestra Casa to offer our team, which has been working nonstop since the beginning of this pandemic, with additional support to care for their own health and their own family needs. During the last 5 months, our team has spent hours listening to our students and searching for resources to help alleviate their barriers that have only been perpetuated by COVID. Being in constant giving and reacting mode can and has in many moments taken a toll on our small team. But overall, this funding will help us take care of those who have been helping our small community move toward defeating COVID. So thank you, Community Health Plan of Washington, for your support. Yeah, so thank you so much, and I will pass it back to Leanne.
Okay, well, thank you both. I appreciate so much the work that your organizations are doing, and the organizations, all of the 23 organizations, and of course there are many more that are just doing such incredible work to help our communities, and particularly during these challenging times. So thank you so much. I just want to say how important our partnership is to me personally and to our organizations, and that we hope that this is just a small step in how we work together and partner together in the future. We know that you are serving people that are the same people that we are serving, and we can't do it alone. We have to do it together. We have to do it through the power of community. So thank you again for your time today. And thank you for all the work you do, most importantly.
That concludes our afternoon program. Thank you all very much for your time, and we will, for any organization who was not able to join us at the beginning at 1:30 to join us in our check passing video that we're going to put together, we'll be reaching out to you to see if we can arrange a time to get you as part of the video we're creating. Thank you so much.
Yay.
Thank you.
Thanks, everyone.
Thank you.
Thank you. Terry, do you want us to stay on, or we are?
We're done. We'll go into chat and I'll be sending an email to everyone to do some follow-up.
Okay.
Thank you.
All right. Well, thank you for the opportunity, guys.
Thank you for your time.